Welcome, everyone. We can ask you to take your seats, and we'll get started right away. My name is Eve Omar, and I am one of the directors of health services with the WRHA. We'd like to welcome you today to the first public engagement session that we are doing, titled System Navigation for Older Adults and Their Caregivers. This is an opportunity to meet your system navigators, to learn more about how to access health and social services, and get a sense of our complex healthcare system. A couple of items first. If anyone needs sign language assistance, we would ask you to move to my left side or your right side of the room so you can have a better view of the language services. And next, I'm going to introduce you to our panelists here, who will later on, you'll hear more from them, and they'll introduce themselves. But I will let you know who's here for now. We have, and I'll ask you to raise your hand, we have Family Doctor Finder, Agent Opportunity, 211 Manitoba, WRHA Indigenous Health, Canadian Mental Health Association, Seniors Resource Finder. And I hope I haven't missed anybody here, so I don't think so. Before we get started, I would also like to read out to you the WRHA Statement on Traditional Territories. The Winnipeg Health Region provides services to all nations on the traditional and ancestral lands of the Anishinaabe, Ininiwak, Anishinaabe, Dakota Oyate, Dene, Inuit, and the national homeland of the Red River Métis. Treaties were created with the First Nations and include past, present, and future inhabitants, so we are all treaty people. Winnipeg Health Region serves those on Treaty 1 and Treaty 5 lands. We acknowledge the 5 Dakota communities in Manitoba that are not signatories to any treaties with Canada. We acknowledge that Winnipeg takes its drinking water from Shoal Lake 40 First Nation. We acknowledge that the acts of colonization, which are part of our history, have caused deep, lasting harm, which continues today. We commit ourselves in a good way to learning about truth and reconciliation, promote healing, and creating a better future for all. We ask you to take a few minutes and just reflect on that statement, and if at any point anyone would like to comment on that from personal experience or other, we would like to hear from you. Just a few housekeeping items as well, just so you're aware. The washrooms are located right outside of the front doors here, so men's and women's are just outside the doors. We ask that you put your cell phones on silent or vibrate so that we can have full engagement in today's presentation and the question and answer period later on. The structure of the event is that we will do presentations first, and then we will ask each of the organizations to come up and speak, and you would have the opportunity for public engagement, ask questions, and we will also have the virtual questions that we would read out to you as well. Today's session is in person with all of you, but we also have a virtual live stream going on right now through the WRHA Facebook and YouTube channels. So those folks that are on virtual will have the opportunity to write in the comment section, and we will read out your questions that way too with the panelists. If you've not received a booklet on your way in, there is still a chance for you to receive a booklet. We would encourage you to take one. It helps to kind of follow along and as a tool for you. You can also grab one on your way out, or if you'd like one right now, you can raise your hand and our host will bring a booklet over to you. Today's session is really intended to have a respectful environment of information sharing, question and answer. And we ask that we keep this a very respectful and considerate environment. We know that many people here have already had experiences with the healthcare system, and some may not have been to the satisfaction. We understand that personal experiences have certainly played a part in understanding the healthcare system. So for today's session, the purpose would not be about specific experiences, but we would invite you to also contact the WRHA Client Relations. And I'm just going to ask Scott to move to the next screen. So the WRHA Client Relations is a department within the region to help our patients, clients, and residents navigate their healthcare journey. So they're a point of contact for you if you have questions around the healthcare system, but they're also a point of contact if you have any concerns or questions about your own experience or care. They will take your information, hear you out, and channel it to the appropriate pathway for solution. The phone number is provided here, as well as the email, and you can find us on our find this information on our website as well. So why are we here today? And really this came out of many public engagement sessions that we conducted as the WRHA was building its 5-year strategic plan, 2023 to 2028. We heard from public, from yourselves, from our communities during these public engagement sessions that you want to hear more. You want to have these opportunities for question and answer, for us to bring the information to you, and understand more of what the healthcare system is about. So we heard that, and that's one of our key aspects of our strategic plan, and this is our first session to make that happen, to bring the information to you. You can go to the next slide, Scott. So what is our goal for today? The goal is to help you find and access health and social services, to help you remain at home in the community, living independently and as safely as possible for as long as you wish. And our panelists here, our system navigators, are here to answer those questions and help you understand what's in the system and how to access those services. You can go to the next slide, Scott. By the end of this presentation, you should be able to find your system navigators, how to connect with one, reflect on specific questions related to your health and well-being, explore topics to discuss with your family or caregiver about your own health planning, locate resources you can use and share with others. So system navigators. System navigators are people and organizations, such as the people we have here today, who are your go-to people. They can help you access those services, navigate the complex healthcare system, and they're the ones that are most up to date on what information is out there and what resources are out there. So while they may not be an exhaustive list here of all the organizations and services we have, they will know how to redirect you to the appropriate service or resource that you may need. And who do they find resources for? System navigators find resources for people who are looking for supports or are just not certain how to find those supports. It could be for older adults, it can be for family members and caregivers, or even as you're planning your own future health needs. People that may access the services would be, as I mentioned, older adults or caregivers who are experiencing addictions or mental illness, those with low or fixed income needing some additional financial supports, newcomers, members of the 2S LGBTQIA+ community, those in circumstances of domestic abuse, and anyone who's just uncertain where to go. So why are system navigators important? It can be hard to know where to go to find specific supports that are available in your area. And one thing that system navigators are well versed in is what is available in your particular area. Some areas may have a higher older population, some areas may have a higher newcomer population. So while services are available throughout the city, some concentration of certain resources may be available in different community areas that the system navigators can help you access or understand where they are. And how will the system navigators help you? Organizations dedicating to helping the general public find a wide range of programs, services, and resources to meet physical, mental health, and economic and social needs. So really, they can help you navigate many of the resources, not just health, but also social services and supports. And where do you find system resources? Where do they find system resources? Community-based programs and public health and private healthcare delivery, connection with former healthcare services, support groups, community organizations, private services, and even some volunteer services that are really can provide a lot of extra assistance and help to people. Scott, you can go. Thank you. So the 6 dimensions of well-being, these are the dimensions that really help us to feel like we are living a full life of satisfaction, of health, and well-being. So the 6 dimensions, it's not just the absence of disease or illness, but it is a complex combination of a person's physical, mental, emotional, and social health factors. Well-being is strongly linked to happiness and satisfaction. It is, in short, described as how you feel about yourself and about your overall life. So here are the 6 dimensions of well-being. So health, you get answers to physical and mental health questions and finding the services that you need when you need them. Home, taking care of your home inside and out. Renovations, or learning just about housing options and how to maintain your home environment. Transport, there are several transport services and resources available in the city to help people get around. Finances, learning about what are the financial options available, tax services, and how you can afford the daily things that you need to lead a healthy lifestyle. Social, try a new activity or participate in social networking, volunteering, and other ways to connect with the community. Equity and inclusion, find resources that relate to your diverse and unique needs and experience. And moving to the next slide. So a few key factors that are really important to consider as part of your own personal planning is maintaining health and well-being means knowing how to find help when you need it, and that's what today's session is here to help with. Your needs may change over time, and we may need to realign or redo our plan and rethink what our needs are over time. Planning for living well and safely at home is a choice every person makes based on what feels right for them at that time. And use constructive communication with your family and caregivers or those that will help you to have that discussion of where you're at, proactive planning, and what you need so that your loved ones know how to help you in that process. So your checklist, we'll now go a little bit more deeply into these 6 dimensions, and then I will ask our system navigators to come up one by one to go through the checklist and that dimension, and then and also introduce themselves when they get up here. So over to the first dimension, which is health. And you can go to the next slide, Scott. So health system navigators can help you find health services, how to find a doctor or access dental, vision, hearing resources, counseling, addictions, and mental health resources. There are public and private home care services. Home care is one of our largest programs in the WRHA, and accessed by many older individuals. Fall prevention information and mobility devices, emergency response information known as the WRHA kits, foot care, meal programs, grocery deliveries, and so on. So moving over to the next slide, and I'm just going to ask Family Doctor Finder to come up, and Shelley will introduce herself and walk us through the list.
Thanks, Eve, and welcome and good afternoon, everyone. So as Eve mentioned, health is one of 6 dimensions of well-being, and where possible, focusing on the things that can keep us healthy for as healthy as possible, for as long as possible, are key to being able to remain in the community for as long as you can. And in short, focusing on these things can help give you the power of deciding when you want to move and when it's right for you. So creating a checklist and following it as best as you can is a great opportunity to do this. So in looking at the checklist, it's interesting. So the first one is to work with your doctor to make sure that you can manage any medical conditions and so forth. I'm going to one ahead of that and say, but not everybody has a family doctor. So that would be something that we can help with, and we'll talk about that in a little bit. So in having regular access to primary care, it's essential to being able to be as healthy as you can in community for as long as you can. So if you have a family doctor or a primary care provider, and you're able to see that person on a regular basis and have the things that are concerning you in the moment addressed in the moment, or addressed as you're able to and as you need to, that's key to keeping you out of urgent care or acute care emergency departments and stuff like that, and being able to keep you in community as long as possible. So having a family doctor finder is important, having a family doctor or a primary care provider is important, and we can help you with that. The second, like having regular appointments for physical, vision, dental, and hearing checkups. So again, along the same lines, you're hopefully in control of your own care as best as you can, or proxying for somebody, a helper, that can help somebody navigate some of this, but regular attendance to these things is really important. Having access to, being as active as possible, getting exercise. So I noticed when I was coming in today that there was an exercise class going on next door. There's exercise classes available everywhere for every ability of person, so if you need some modification, those are always super helpful. As well as having access to healthy sources of food, so fruits, vegetables, those sorts of things, and I recognize that food insecurity is something that's very prevalent for lots of folks, so hopefully some of the systems navigators can help point you in the right direction there. Activities of daily living, that includes sort of just being in your home and getting the things that you need some support with on your own, so bathing, preparing meals, cleaning your home a little bit, those sorts of things. So getting connected to services, there's private and public services that are available to help in those ways. Knowing where to find mental health resources. We know that especially in COVID era and post-COVID, that mental health was something that was experienced by most people were impacted by that. So knowing where the resources are and how to access them is really important to keeping your health and wellness as healthy and well as possible. Being able to balance your own needs. So some of folks in the room, I'm going to suggest you're probably caring for yourself. You might be caring for your kids. You might be caring for your parents. Making sure that you know how to do all of that in a balanced way so that you're as healthy as you can be, and then helping the folks that you're helping is in the best way that you can. And then being able to have access to things like the WRHA kit, which is the Emergency Response Information Kit, so that if you have that filled out and it's ready to go and somebody happens to come to your home in an emergency kind of situation, you've already mapped out all of the things that you want people to know about your care and what your wishes are. So I know there's somebody else will talk about it, but there's some kits at the back. So having a checklist like this is super helpful. It might not look exactly like this, but it's something that you can create on your own, like things that you can keep so that you can kind of keep on track with what it is. So for Family Doctor Finder, so one of the things I think is important to know is that Family Doctor Finder is a provincial program. So all of the central registration goes through Manitoba Health, and then depending upon your region of residence, so Winnipeg in this context, but if you live outside of Winnipeg, you would probably be registered in another region. That goes to a regional team, and then the regional team will contact you, ask a bunch of questions, because we want to know what your medical needs are so that we can best provide a match to you that's going to make sense and work for you. If you're not able to register yourself, or you're not able to advocate on your own behalf, you can have a proxy that will do that for you, and we'll speak with them and help you navigate that system. Once you register, it comes to, in Winnipeg, it'll come to my team. Right now, it's taking up to about 4 weeks to get back to you, so I just want to set some expectations. Our normal time frame is less than 2 weeks, but we've had a lot of providers in the last couple of years leave the province or retire, which has left a lot of people looking for care, so it's taking a little bit longer than normal, but we will get to you. We'll contact you, we'll have a great conversation, and then we'll be able to figure out what's best for you and then do our best to make that happen. Another thing that's important to note is that Family Doctor Finder is a voluntary program, which means that physicians have to agree to work with us in order for us to send referrals to them. So we contact clinics all the time. We try to get providers to come on, but our list changes daily because providers that are working with us get full, or they for whatever reason can't take more people, and then we have providers that might start taking patients, and then for some reason they might have to leave the province. Like, there's all sorts of things that happen. So we do our best, but please be patient and understanding that we can only refer to who we have that's agreed to work with us, and that right now that's unfortunately a little bit limited. But we also want to find what's best for you, so we do our best to be able to do that. Some other services that the team can provide in terms of systems navigation is that we can provide access to episodic care or resources to access episodic care. So sometimes when you're getting a name of a family doctor or a provider, you may not be able to get in with them right away. There's a meet and greet process, so it might be a few weeks before you get that. It might be like a little bit longer to get a medical appointment. You might need care in advance of that. So in those situations, we would say go to a walking connected care clinic or a walk-in clinic or urgent care or emergency, depending upon what your needs are. So we can provide that. We provide mental health resources so that we kind of keep up on what's going on in that area and make sure that people have access to that information. We have parenting resources. We have lots of folks coming through who are pregnant or just had a child, and we want to make sure they have all the information that they can have available to them. And then senior support resources as well. So my team knows the Healthy Aging resource teams really well. We know we're partners with the senior resource finders in terms of some of that combination, so we're able to redirect to some of those resources. And of course, our partners at 211 Manitoba, who will talk about their own services, we do work with them quite a bit as well. So I think I'll leave it at that. I'm happy to answer questions when we get to the Q&A, and I'll be hanging out at the back corner at the end if you have any questions as well. Thank you.
Okay, thanks very much, Shelley, for all that information. So our next dimension is home. And over to the next slide. So for this section, I'm going to ask Agent Opportunity to come up and speak to the checklist.
Good afternoon. My name is Amanda McRae, and I'm the CEO at ANO Support Services for Older Adults, formerly Agent Opportunity. So we're under this domain of home. And the checklist is looking at issues around, have you thought about safety risks in your home, and have you taken steps to fix them? So some of the things that we might take for granted, like scatter rugs and appropriate lighting, those types of things, are sidewalks cleared that make it easier for us to navigate and avoid trips and falls and those types of things. If my mobility changes in the years ahead, I'll still be able to get around my home, or we'll be able to modify, example, maybe putting in ramps or adjusting doorways to accommodate wheelchairs or walkers, scooters. And then if I'm no longer available to stay in my current home, I know where to look for other housing options in my community. That's tricky because we know housing is challenging right now. So what does it look like in terms of your socioeconomic status? What is reasonable and realistic in terms of what you can afford? Do you have a pet that you want to keep with you? All of these considerations are something that folks need to look into, and often it's really great if you can be as proactive around looking as you can. You might not be ready today, but maybe in a year or two. So looking at what your options are before you're in a situation where you really have to do it tomorrow. When we look at what happens with system navigators and helping you under this domain of home, we're looking at issues around, what are those things that might help you manage in your home for longer? So what kind of home equipment options are available? Home maintenance, can I get someone to help me fix this door that isn't closing properly? Home modification services. If I do need to make a doorway wider, is there an occupational therapist I can connect with? Who can do that kind of work, and who can help? Maybe I'm living in lower income, and where are some affordable, safe, bondable folks that can assist? Information about housing options. Where do I even begin to look? It's super overwhelming. I want to make sure I stay in the Fort Rouge, Riverview community area. What are options available? Safety alert device information. So we partner with Victoria Lifeline. Maybe that's an option for some people that'll make you feel that you can stay in your home longer. And yard maintenance services. We all know that living in Winnipeg is a bit different than living in Victoria, BC, and that maybe we have some white stuff we'll have to contend with sometime. Hopefully not too soon. So that's a lot to take in, and it's multifaceted, and we need, as Shelley mentioned, we all need to work together, because there isn't any one community, resource, not-for-profit or otherwise, that can do it all. So we need to make sure that we're linking well and communicating with each other to provide those services. So A&O Support Services for Older Adults has been around since 1957. And in this work, we have 3 primary pillars of service. One is safety and security, and under that pillar are many different programs and services, which I won't have a ton of time to get into for you today, but I'll just highlight the titles of those programs so you have a sense. So we spoke before, Eve mentioned elder abuse, and unfortunately that is happening with older people. So we have elder abuse prevention services within A&O. We also have the Safe Suite program, and within the City of Winnipeg, we have 2 Safe Suites that can be accessed. We also work with the Winnipeg Police Service and provide older victim services. And then we have a Safety Aid Falls Prevention program, and that's really connected to aging well in community. We really, none of us, no matter how old we are, want to experience a fall, because we know that having a fall can also be sort of the initial catalyst to having us not be able to live well independently. So we want to make sure that we're doing our best to prevent falls. And we also have a program called This Full House, which addresses hoarding and squalor behavior among many people, which puts them at risk for falls and fire and evictions. So we want to make sure that we're really watching. And some of these things are kind of heavy to talk about, but it's okay to talk about them and know that you have a safe place to talk about them and the supports available. The second pillar of service, and we know this more now than ever before since pandemic, is the ability to stay socially connected and engaged. So our whole pillar is titled Social Engagement, and under that program, some of you may have been lucky enough to participate in the Senior Center Without Walls program, which is all delivered over the telephone. So you can do everything from bingo to art therapy to yoga, you name it, it's all there. The Connect program, which helps match people with volunteers, whether it's somebody that calls you or goes into your home to visit you. And then we'll also get into this a little later in this presentation, is Senior Immigrant Settlement Services, which really helps many newcomers, older adults coming to Canada, our province, and in the city. And then the last pillar is our counseling services. So it sounds kind of obvious, but we provide sort of general counseling services on many types of issues around bereavement, issues with living with older children, adult children, information and referral, which this whole event is about, connecting you. If it's not a program or service that A&O has expertise in, we will do our very best to work with our amazing community partners and connect you appropriately. And often we know that people they have a basket of services, so it'd be great if we just, hey, can you help me with this one thing? And unfortunately, or fortunately, people are a lot grayer and we need all kinds of different supports, and that's okay. And then intake, we will connect you with our intake worker, and that person will help you navigate, okay, here's what we can do for you, here's what we might need to refer out to you. And then some supports for caregivers and what they can do to find support if you are caring for someone, your partner, adult, if you're an adult child caring for a parent, just different types of supports that can help you manage that role more effectively. So that's just a little bit about A&O. Thank you.
Okay, thank you very much. And next, we will have Transport, Seniors Resource Finder.
Good afternoon, everybody. My name is Patty Berube. I'm the Seniors Resource Coordinator for Fort Garry. Just to give some context to that, Fort Garry is defined from south of the Jubilee Underpass all the way out to and including St. Norbert. To the right, or to the west is Brady Road, and to the east is the Red River. There's actually 22 neighborhoods in Fort Garry and over 35,000 older adults over the age of 55. There's 12 coordinators in the city of Winnipeg, so if you don't live within those boundaries, there is a coordinator somewhere in the city for you. My role as the Seniors Resource Coordinator is to connect you to different programs, services, businesses, to keep you living as independently as possible for as long as possible in your own home. That house can be, or that home can be a house, it can be an apartment, it can be a condo, whatever challenges you're facing living in that space, I can provide information and referrals for you. I work with all the other system navigators to try to connect you to as many programs and appropriate programs and services as possible. So regardless of the type of housing you live in, whether it's a house, apartment, or a condo, there are challenges as we get older. As we've heard, it may be that you can't do your housework anymore or your yard work. Or snow removal, so finding a resource for that. You might not be able to get your groceries or prepare your meals. We can also find a resource for that. Or you may just be living alone and socially isolated, so connecting you to programs like A&O's Senior Center Without Walls and Connect. One of the biggest challenges that we face as we get older is transportation. And if we give up our driver's license, we really are giving up some of our independence. So the checklist here, you've talked to your doctor and pharmacist about how my health and medications can impact your ability to drive. You may have to give up your driver's license due to physical limitations. It may be due to financial resources as well. You're aware of delivery or online shopping services that you can use if you cannot drive. And the third one is you have thought out how will I get around if I'm unable to drive myself. So where you're living, whether it's in a house or an apartment block or condo, how close is it to the bus route or how close is it to amenities? As a system navigator, I can help you find the best option for your situation. So what are some of the delivery services out there? How to have a driving assessment. There are a number of rideshare programs like Uber, or you may want to organize an informal rideshare even within your own block or your neighborhood. It might be applying for Transit Plus. You can no longer drive and you want to apply for what was called Handy Transit is now Transit Plus. You might want to learn how to navigate the City of Winnipeg transit system, especially if you haven't done that in a number of years. I can assist with that as well. There are volunteer driving programs across the city, in some parts of the city, and we can try to connect you with those as well. So there are a lot of options, and as the system navigator, I meet with you and discuss what is the best option given your mobility, your financial resources, and where you're located. Unfortunately, with COVID, we did lose some of our transportation resources, which has made it a little bit more difficult to get around. And the senior resource coordinators across the city as well as some other community partners and an organization called TONS, Transportation Option Network for Seniors. We are working together to try to come up with some solutions. In addition to information and referrals that I can provide, not only on transportation, but on housing and grocery delivery and home maintenance, I also have the WRHA kit, which was alluded to before. So I will be located at the back of the room after the Q&A. Feel free to stop by and pick up an WRHA kit or two from me. I also have a rack card with my contact information on it. I work mobile, so I don't have a set office location. So the rack card will contain my phone number and my email address. I do host pop-up clinics in the community at 55+ blocks, as well as Access Fort Garry, and I just try to get out into the community as much as I can to go where the older adults are and to meet with you there as well. In addition, I also have a newsletter for the Fort Garry area to keep people informed of all the different programs and services that a lot of the community partners are offering. So if you're interested in that, I can connect with you as well. So going back to transportation, it is one of the biggest challenges of aging. There are options out there for you. We just need to discuss them, and we are working on solutions to try to make transportation more accessible. Thank you.
Okay, thank you very much. And the next dimension of well-being is finances, and we'll invite 211 Manitoba.
Hi everyone, it's nice to see you all, and we get to talk about finances, everyone's favorite topic, and also most stressed out topic. So I'm Daniel Leonard, I'm from 211 Manitoba, the director of 211, which is a program of United Way. We'll get into that a little bit more, but just to acknowledge a couple things. One is that when we talk about older adults, that huge category is a huge category, and so we're all in it's very different life stages, whether you're 55 or whether you're 100, there's a lot of things that go on in those years. And so there's, with that, many different needs that come in that. So I want to recognize that off the bat. Also to acknowledge, as we talk about finances, that it's a really difficult thing. It's a really stressful thing. It's a really complicated thing. So, many times when we are in that stage of life, the amount of money we have coming in is stagnant. But as we know, especially in the last couple of years, costs keep going up. And that's very stressful, a very difficult situation. So I want to talk a bit about that and how we might be of assistance to you. So to get into that, thinking about our finances, some of these questions that come to mind. I have a financial plan. I'm able to maintain my standard of living in the future. I have a power of attorney, a will, and a healthcare directive. These are really key questions to be considering in terms of our financial well-being. But as I said, there's many different stages and situations that we're in. Sometimes finances aren't even these things. It might just be, how do I get food tonight? How do I get food in the next week? How do I take care of my loved ones? Those types of questions are so stressful. And so 211, we're very much here to help you navigate that. One of the things that I want to consider as we talk about finances is there's many supports out there. And so, when we talk about benefits programs, for example, we just went through an election. In the course of an election, you hear many things that happen, many promises, many opportunities, many new programs that come out. It's hard to know what's actually out there when the dust all settles. What's there, and what am I able to access? That's very stressful. A simple internet search, a simple Google search might not get you to that place. You might find an old press release, and that program never actually came through. What we found with 211 Manitoba is it often takes up to 7 phone calls to get the right information. That's research that's happened. That's exhausting. It's exhausting to explain your situation over and over again. And so we want to make that, one phone call or one friendly pass off to an agency that we know has the information. 211 is here. We're available 24/7. It says we're available in 150 languages. We've actually just increased that. We're over 200 languages now. Many times when you're in a stressful situation, you want to speak the language that you're comfortable with. And so we know, there's many newcomers to Manitoba. You might want to speak a language that you're confident and comfortable in. We're able to provide that. We're able to connect you to healthcare clinics, to income tax clinics, to benefits finders, so that you can figure out what are the benefits that are available out there, what are the income supports that are available out there that I can access. As you may have picked up, there's lots of overlap between what we're all talking about. You can rest assured to know that we are all connected to each other as well. These aren't strangers. We work in partnership with one another. We're integrated with one another. 211 maintains a database of over 11,000 programs that we try to keep up to date. And we find that information for you so that you can call us about finances, but really about anything, and we can connect you to the appropriate place so that you know that it's a reliable information that you're getting. So just a reminder, if you're ever stuck, you can pick up the phone, you dial 211 at any moment, and we will connect you to an agency, to a program that can meet your financial needs or otherwise. So I'll just leave it there and keep it simple and pass it on. So, thank you, everyone.
Okay, and for the next dimension is social, and we will ask Canadian Mental Health Association to come up.
Hi there, my name is Cheryl. I'm from the Canadian Mental Health Association. And when we think about social, we think about relationships and connections with others. And what we know is that having positive relationships, having really good connections, and even just the opportunity to get out and talk with other people, experience the community, could be as simple as even just going to your favorite grocery store and saying hello to the cashier that you have a preference for. It's really important to our well-being, our wellness, and our mental health. And without relationships and positive connections, we experience isolation and loneliness, and we know those are very detrimental to our mental health. Too much isolation, too much boredom, too much loneliness, and we're struggling with depression, anxiety, self-esteem, and we might be feeling like we're just not connected to the world and feel just really left out. And so it's really important that we think about socializing. And when we do, we think about this checklist. We want to consider, do I have friends that I can rely on who will be there if I need urgent help? And so support when we really need it, having people we can count on is essential. And we're looking at, individuals in our lives who we can trust, who we can count on. Sort of those people that we call at like 3 o'clock in the morning and we know they're going to answer the phone and they're not going to yell at us for calling if it's really important. Do I have social activities that make me feel fulfilled? We all need to go out and have fun. We need things that distract us. We need things that are interesting, that stimulate our brain, that are going to give us maybe some new information, learning opportunities, things like that. So we want to think about where do we go, and when we go out, what do we do? Do we have hobbies? Do we have interests? Do we have things that are still making us feel alive and feel like we're participating in the community? That could be exercise programs, that could be clubs, that could be social groups. It could also be opportunities to take courses or learn something new, new hobbies, or even just come together with other people to perform hobbies or participate in hobbies. I know where I can go to find social opportunities in my community. So that can be a real barrier for us. We want to get out, we want to have fun, we want to see other people, but we don't know what's available. And that's where our system navigation comes in handy, because being able to connect with someone, being able to talk and find out that information is really essential. So system navigators can help with clubs and programs and just help you find places that are a match for your interests. Can also help with brainstorming, in-home activities, finding different kinds of social programs, places where you can meet new people, places where you can gather with some people that you might have something in common with and have chit-chats or participate in different things. That includes senior centers. And something we know about relieving isolation and loneliness is that volunteer opportunities are a really great way to do that. So when we get out, we volunteer, we get involved with others, support others. What we know is we stop thinking thinking about ourselves, we get a little out of our head, and we start to feel really engaged. We start to really feel like we're contributing to the world that we live in and doing something really positive. So all of these kinds of social opportunities are really essential, as I said, to our mental health. And in terms of the Canadian Mental Health Association, we really focus on socialization, relationship building, and looking at the aspect of how do we develop trusting and meaningful relationships in our lives. And so you can give us a call. Our number is 204-775-6442. That's our service navigation line. It's open 8:30 to 4:30, Monday to Friday. And when you call, either you will get somebody who will pick up the phone and say, how can I help you? Or what you might get is an opportunity to leave your name and your number, and somebody will call you back. You can ask questions about various programs that are happening in the community regarding mental health. So it might be, where can I go for depression, or where can I find a support group, or how do I talk to my doctor about some of the anxiety I've been feeling, or how do I describe this, to my family so that they understand what I'm going through. But your question also might be about, what happens at CMHA, and we have a lot of different programs, including Bounce Back program, which is a phone resource where you can meet weekly on the phone with a worker to talk about mild or moderate anxiety or depression. We also have our learning center where there's opportunities to do a variety of exploring different topics, like how do I build self-compassion, to how do I learn to knit, to just, some art activities for your well-being. And we have a variety of different more focused programs at CMHA, including some senior services. So if you are interested in mental health as a concern for you, or something that you're curious about, give us a call. Thanks.
Here's the next dimension, equity and inclusion. I'll invite WRHA Indigenous Health.
Good afternoon. My name is Jeremy Moore, and I'm the Workforce Development Coordinator with WRHA Indigenous Health. I'm Métis from here in Winnipeg, with roots going back to York Factory. So when we're talking about equity and inclusion, there's the list here on the screen. You may fall into multiple categories of this. So you may have experienced harm or trauma from the medical system in the past because of cultural, religious, ethnic, or sexual identity. So that could be racism or discrimination. You want specific spiritual or cultural practices honored and respected. English might not be your first language. I know as an Indigenous person, there are many people who don't speak English as their first language, and everyone deserves to receive their medical care in their first language. You might identify as Métis, First Nation, or Inuit. Some people may just say that Indigenous. You might be a newcomer, an immigrant, or refugee, or you may identify as 2S LGBTQ+. So again, you may fall into multiple categories of that. When it comes to system navigation, so I represent WRHA Indigenous Health. We're one of many organizations out there that assist Indigenous people. We are a WRHA program that has a focus on navigating those who are accessing care, either in the hospital setting or in one of the many community programs like access centers. We support Clinic with a K, MATC, Cancer Care Manitoba. I can name quite a few organizations. And the way that looks, so we do have language interpretation, so our interpreter resource workers provide language interpreting in Ojibwe, Cree, and Oji Cree. They also provide resource coordination. A lot of that has to do with non-complex discharges and assisting people with support in their homes. Discharge planning and coordination, that oftentimes is more complex discharges, specifically to northern First Nation communities, where, for example, it might be fly-in only. Every First Nation community's services are different, so navigating that can be complex. And then when you throw in the fact that for First Nation communities, the federal government is responsible for healthcare, so throwing that into the mix can be daunting for a lot of people, trying to determine who's responsible for what. That's where our discharge planners can come in. Advocacy, we do have a patient advocate on staff who assists with concerns, complaints, works alongside with client relations with the WRHA. We've got spiritual and cultural care providers as well that assist with Indigenous ceremonies. And we also assist with Indigenous medical transportation coverage. That's really in conjunction with the federal program, First Nation Inuit Health. We also do provide assistance outside of, I'll call it the hospital setting. We have centralized support assistance that can take calls from the community. So if you are looking for mental health supports in the community, you are looking for assistance with EIA or disability applications, you don't have photo identification, our centralized support assistants can assist in coordinating where you would go for that. Like I said, there are many, many organizations that assist with Indigenous people. No one's expected to know them all, but Indigenous Health can assist with pointing people in the right direction and attending some of those appointments, depending as the case may be. So our phone number is up on the screen, so toll-free 877-940-8880, and our email, indigenoushealth, all one word, at wrha.mb.ca. Those are monitored by centralized support who will either assist or pass it off to one of the appropriate team members within our team. Just on the previous slide, there was something about A&O. I'll invite the rep from A&O up here to talk about their part.
Thank you. All right, just to speak a little bit about A&O's Senior Immigrant Settlement Services, and I'm very lucky that my colleague Maureen Keelan is here, and she's the manager of Senior and Immigrant Settlement Services. So after, if you have more questions, we'll be in that back corner there for you. But you can imagine how challenging it would be to come to a country where you don't have the language, and often you're leaving some very difficult circumstances. So not only are you here to learn English, but you might have a lot of trauma and other issues that come with that. So we're quite lucky at A&O where we have a number of wraparound services that can support the individual. And again, if we can't deliver that service, then we connect them to those baskets of services that they may need. There's issues around housing, there's issues around food security. And I did not mention before that we have an innovative partnership with 211 Manitoba, that if you call as an older adult or an adult child or someone concerned about an older adult looking for services, they can connect you very specifically around resources and supports for older Winnipeggers. So help yourself. There's new magnets for your fridge back there you might want to get. So just to give you a little bit of a rundown about Senior Immigrant Settlement Services, is the program offers a wide range of settlement services for people who are 55 plus, newcomers. Our settlement orientation for seniors program is a group orientation where participants learn about important settlement topics such as law, health and safety, housing, transportation, money and banking, and community information, kind of like all the things we're here to learn about today. So these are really important. Why do we have to plug our car in the wintertime in Winnipeg? Super weird, but that's important. Upon completing the orientation, participants are referred to the Winnipeg English Language Assessment and Referral Center, or WRHA, for a language assessment appointment. They may then register for English language classes through A&O, and they're welcome to join one of our English conversation circles. A settlement worker is also available to provide additional information about community programs and services, so again, that referral if it's required, and assists with helping to fill out forms and documents and offer opportunities to connect with other older adults in the community. So again, a really important program for older newcomers 55 plus. Thank you.
Thank you to all the panelists for coming up here and sharing all the information. As you can see, all the system navigators are very connected by knowing the health and social services resources available, and the interconnection is really to your advantage, so you know who to contact and they will redirect you to the right place. And that actually does conclude our panelist presentations. What we would like to do now is open up the discussion to you, if there are any questions from the audience. We also have the opportunity for our virtual participants to also write your questions in the comments section, and that will actually pop up on my screen, and then I'll be able to read the questions out loud. And your questions will be directed to the appropriate system navigator here. So we'll just give you a minute to think about a question, and we'll open it up. Does anyone have any questions or any comments for us? Yeah, we'll just get you the microphone here.
Just stand, and you'll have to put it close to your mouth.
What does ANO stand for?
ANO, what does it stand for? Can we turn that microphone on?
Test. Oh, there we go. ANO is formerly Age and Opportunity. Yeah.
Yeah, and lots of great services through ANO. Any other questions or comments? Up front here.
Oh, excuse me, hold on. Can you
We'll just
stand?
get you the microphone here.
Okay, the Seniors Resource Finder, all that, hi. I was just wondering, does it get updated periodically too as well? Does this information change and then you get more information as it goes along?
I think this is on. The resources are always changing. So as seniors resource coordinators across the city, we need to keep on top of what's no longer in service or what's a new resource out there. And as I mentioned before, there's 12 of us around the city. So we're always looking for new resources and just trying to stay on top of everything. So. For the Seniors Resource Guide, that would be 211. I have very limited quantities. If you have access to the internet, the best solution would be to download the 211 Manitoba, or the Seniors Resource Guide from the internet. Yeah, because there's very few hard copies. Yeah, yeah. Okay, thank you.
Thank you very much. I hope that answers your question. We had a question here, and then one over here, and one from online as well. Go ahead.
Hi there. I'm not really sure if this is the appropriate or an appropriate question to ask, but if I have a family doctor and I can't get in to see my family doctor and I go to a walk-in clinic and am seen there, is my family doctor able to access information about my visit so that he or she can provide continuity of care, or is it my responsibility as the patient to relay that information to my doctor?
That's actually an excellent question, and probably many people are wondering that. Shelley, did you want to answer that, or I can?
We can tag team. It's a great question, and generally what happens if you go and see a walk-in doctor, the results of whatever it is, if you're being sent for testing or blood work or anything else, will go back to the doctor that ordered those tests. So generally speaking, there's a couple of things is that you probably would like to ask the walk-in doctor to share those results with your family doctor. Depending upon the system that they use, sometimes medical records are accessible depending upon the system that your family doctor uses and the system that the walk-in doctor uses. But the safest thing, and Eve might want to add to this, the safest thing would be just to ask the walk-in doctor to ensure that the results are shared, but also follow up with your physician to let them know that you went to a walk-in, had a test, so that they can also follow up. So it's a bit more legwork for you, but in order to ensure that it happens, I would suggest that's probably your best bet.
Would you mind actually talking right into the microphone so we can all hear?
Is there any way that we can access, as a patient, for our own care, can we access our results so that we can keep it on file so that we can be our own, we can help ourselves? Is that something that we can do?
In short, yes. You should be able to work with your provider to request your medical records. There's a bit of a system involved in it. Like generally they would set that up and then you would have opportunity to go through your file. If you're transferring clinics, like if you're going to a different doctor, then you can request your records. So unless you have something different than I would be aware of, Eve, you should be able to access that by requesting it directly from your provider.
Yeah, that's correct. And we do have many patients who do request their records. So that's usually not a problem. It's just a bit of a form to sign, and we can release that information. We do have a question from online, and then there's someone in the front here. The question from Facebook is there a cost to accessing an ERIC kit? And I believe there is no cost, but I'm going to let...
There's no cost for the ERIC kit. We do give them out individually. We do sometimes ask for a donation just as a cost recovery, because we do have to pay for most of the pieces that go into the kit, but for individual homeowners, there's no cost. If a big group wants to order 50 or 100 from us, then we do ask for a donation just to help cover the costs.
Thank you. And I understand there are some ERIC kits in the back
yes,
that people can
I've
access.
Got ERIC kits at the back, so feel free to come and see me and get a kit or two.
Okay, and we had a question here. And please speak right into the microphone so we can hear.
Okay, thank you very much. My name is Lisa Tarko, and I'm a WHRA patient volunteer. So if anybody here wants to get involved in the system, look it up on the internet. It's very good. I'd like to thank you folks for putting this on for us. This is so informative. I think it should go out to smaller groups in the communities, like 55-plus apartments and all that. So this is just great. I do have one personal question, and that is, I've been on the WRHA home care program for 11 years now. And I'm with the respiratory section. And right now, my caregiver is my husband, and he now needs help. We can't access the in-home, like cleaning and laundry. And I was wondering, who do I exactly phone to look at that? I talked to my coordinator, and that we just need a little bit extra help. They are short-staffed, they can't do it, and I just wonder about that. That's my own personal question, but outside of that, thank you so much for this seminar.
Thank you. So you have done the correct thing by speaking with your case coordinator. That's the first person to connect with, and they will do an assessment and see, your case coordinator can look at resources as well and what is available through the home care program at that time. There are some other services available around, light housekeeping and laundry, and I don't know if Seniors Resource Finder might be able to speak to that.
So like you said, go through your home care case coordinator first of all, but if you do decide to hire private home care, I do have a listing of companies that do private home care services as well as just the specific house cleaning.
What about a Because my husband can work now.
Right. There are some resources out there that you could potentially be referred to. It just depends, yes, yeah. And there may be a waiting list for them as well.
Okay, we have a couple of questions from online. From YouTube, the question is there any dental program to support seniors? Shelley? Yep.
So, yes, there's a couple of dental programs that are funded by the WRHA, and primarily the one that comes to mind is one through Deer Lodge. So there is a dental program through Deer Lodge that helps to provide supplementary support for folks that maybe don't have insurance or have limited insurance. But aside from that, I'm not sure of anything. But there is the dental program through Deer Lodge. And there's also another one that's through assisted living, I think. But that's one that would require a little bit more looking into to get a better answer for.
A second question from YouTube. This is to transport services. Do you see a demand for your services coming from newcomer, seniors, older adults?
I don't see it specifically to newcomers. I see it across the board for older adults. Personally, I haven't had a lot of requests from newcomers. It's more just people, older adults in the community, so I think it's everybody.
Okay, thank you. Another question from YouTube. And this is to Dr. Finder specifically. Are your services being utilized, used, or known among newcomers serving agencies and service providers? I'll repeat that. Are your services being used or are known among newcomer serving agencies?
So yes, we work with Bridge Care in particular is one that is works with newcomer families coming in from a variety of different countries. Often they're refugee families. The WRHA has also set up a program to receive the Ukrainian families that were coming in based on the war in Ukraine. So we do work with a variety of newcomer organizations, and much like what Daniel had said with 211, we do work with language access interpreter services as well. So we do try to ensure that we can provide supports in terms of our intake in their first language. And then we do also try to encourage what we would call private practice or fee-for-service providers. We also let them know that this service is available to them, that they can utilize it in their clinics so that they can provide that same service for individuals if English is not a comfortable language for them to communicate about their healthcare needs.
Okay, thank you, Shelley. Just going back to the room, are there any further questions? And I think we have a question here.
We're here first. Here.
Oh, you know what? I'm going to come back to you in 1 second. Sorry, there is a question right there with the microphone.
My name is Mary, and I'm one of the ones that plan to live at home, safe and well. First of all, I would like to thank the WRHA and the organizers of this important event, this important launch, that they're launching this event of System Navigators. Now, I have two questions. My first question is the first line of contact, the first point of contact. Yes, we heard that there is a website to go and there is a phone number to call. Let's say I don't have a computer and I prefer to call that number. I forgot the number, but it was on the screen. Now, I'm assuming that by calling that number, I don't get directly to one of the system navigators. I'm assuming, because they don't know what is my desired or my question about which part of the system. Could be health, could be finance, could be anything. So I'm just wondering that, have enough measures been taken to make sure that there are enough staff available to answer that first call? Unless I'm mistaken. So let's say if I call that number, there must be someone to answer that call before to connect me or direct me to a system or my desired system navigator, right? The one that I question.
So maybe we can answer that question first.
Okay.
Would that be okay?
Sure.
Okay, and we'll hand it over to...
I'm not Daniel, but is this on? Yeah, Daniel just stepped away, so I'm speaking for 211, and I'd like to address your question. And that's part of the value of having a phone number that's super simple, 211, and it's open 24 hours a day, 7 days a week, so it doesn't matter when you want to make that phone call, somebody's going to answer the phone. And I think that's really important. And the other piece of that is you're not going to sit on hold for 2 hours. So right now, our average call length time to answer that call is less than a minute. So it's usually around 30, 40 seconds that you might need to wait before somebody is able to speak to you. And when you call 211, the service navigators are going to ask you the questions that need to be asked so that we can find out what kind of supports you need. And then we're going to make the referral. And so sometimes that might mean we're going to refer to one of our agencies here. ANO spoke really well about that amazing partnership of that referral that we can place so that you can get in contact with the right person that you need. So we're going to ask you some questions at 211 so that we can make the best referral for you.
Yes, absolutely, and it's very clear. Thank you very much.
Yeah.
But so I gather that the best first step would be to call 211 rather than that 7-digit number?
You can call. You can honestly call any one of us, and we're gonna make sure that you connect to the right services. But in terms of ease, 24 hours a day, 7 days a week, 211 is an easy, quick number for people to remember. If you call any one of these agencies directly, they're also going to provide you some support.
Okay, that's great. Thank you. My second question, can I ask that?
Yeah, for sure. And maybe even just your first question, if you call the doctor finder number, did you want to speak to like what the access is through that number?
Same idea. So Family Doctor Finder is a provincial program, so your initial contact would be with Manitoba Health. I can't speak on their behalf. They do have registration folks that take that, and sometimes it is a wait. You can also register online, but as you mentioned, not everybody has access to the internet. And then for the second part of that is that we actually contact you, the regional team. So once you've registered with Manitoba Health, that information comes to the regional team, and then we reach out to you directly. If we can't reach you, we'll leave a voicemail. We'll try you again. We give you a number to call us back at, and we have our intake lines are open usually 8:30 to 4:30 Monday to Friday. So we do our best. We're kind of balancing outgoing calls with incoming calls. So I don't want to make the same commitment that Tammy has made for 211, but we definitely try to answer the phone on the WRHA and when the phone calls are coming in, but it's not perfect, I will concede. We have a small staff and a lot of folks looking. So.
Yeah, sure. Thank you very much. Can I ask my second question is about transportation. I gather that there are all sorts of or types of transportation that would be available to a senior or an older adult. But I'm assuming that, or not maybe for sure, there will be some costs to the seniors based on the type of transportation that will be provided based on her or his need.
There isn't a free transportation service anywhere that I know of, and if anybody does know, please let me know. Most are going to be fee-for-service, the cheapest being the City of Winnipeg bus or Transit Plus. some of the volunteer driving programs around the city have reduced rates. And then the most expensive would be taxi rides and escorted transportation. So unfortunately, I haven't found a free service for that.
Okay, thank you for the questions and answers. And we do have a question over here.
You can sit if you need. It's okay. You're okay. Just hello, my name is Linda. A few questions here. One with transport as well. And is there anyone, even understanding there would be a cost involved, that could transport, say, my husband, who I'm his full-time caregiver, and it's getting hard, but I have to get him to endless appointments. And it's been very close where there's times I cannot get him there. I'm not able to. I have to get a transport chair in the car and get the transport chair to the hospital and wherever. And I was looking for a volunteer service for a fee that would take him to an appointment and not just drop him off in front of the hospital. They would take him to whatever floor, whatever doctor he needs to see. Is there such a thing or person that does that?
Yeah, very good question. And go ahead.
Escorted transportation services that you can hire somebody to come and get him, take him right to the doctor's office or the clinic or wherever he has to go instead of dropping him off at the door. That's a paid service through, typically it's a private home care company that will do that. That's about the only option, and unfortunately there is a cost for that, which can be quite expensive.
Ooh. Yeah, that's never good.
As I mentioned before, the Seniors Resource Coordinators and other community partners across the city, as well as a group called Transportation Option Network for Seniors, we are working together to try to come up with solutions to get people to medical appointments and medical tests. And so that's in progress right now.
Yeah. Okay. And like the lady there, I'm, full-time caregiver. My husband is going to be a paraplegic. That's where we're going to. And I'm determined that we can age in place. To me, having looked at all the numbers, it's the most affordable for us. So one of the biggest barriers for me is in the winter, when the snow plow goes down the back lane and they leave that big, what's it called, windrow, yeah. And there I am outside with my cane and my axe, trying to chop this thing up. Now, I've phoned political parties who have talked about, we are all for aging in place. And I'm saying, well, this would be huge for me. And they say, well, that's not the rule. And I said, well, I know that. Can we advocate to make it a rule where in the front of the street, they go by an elderly disabled person and they lift the blade and then they put it back down and drive along. And I said, can they do that in the back? No, it's not the rule. And I've been phoning, actually, political. I don't know who else to phone. I phoned umpteen people to say, can you just do this? Because so far, I'm getting him to most appointments. And you never know, they're usually early. And I've phoned snow removal people, but they don't know when the grader goes by. So I just can't see another path for a solution.
Yeah, thank you for bringing that up. In Winnipeg, that can be an issue in the wintertime. Anyone want to take that on, or any thoughts on this particular matter?
No, that's a huge issue, and I wish we had an easy answer. And the image of you out with your cane and an axe trying to clear a windrow is pretty vivid. So, outside of trying to leverage neighbors or that teenager that lives close by and saying, "Okay, we have an ongoing relationship. Every time they come by, you come." I think a lot of teenagers would be making some good money if they knew how to do this intergenerational partnerships, and maybe that's something we need to do more proactively with some of the high schools in the neighborhood. So I think there are some creative solutions that we could do, but I understand your frustration, and there's no easy answer right now.
And I've looked at that particular solution. There's no kids on my street. And to know when that grader goes by, you have to be there.
Yeah, you for sure do.
I have very good neighbors. They work.
Yeah.
So they're off to work, and then the grader comes by, and
Yeah.
I have to get out.
Yeah. No, it's for sure a tough one.
So how do you advocate to get them, the city, to lift the blade?
211, 311, yeah, the cities. And then probably we need to have a conversation with our city councilors, yeah.
Yeah, and I have.
Okay.
Yeah.
I think we need to keep on keeping on, and you're not being a pest. You are advocating for yourself and your partner, so I think you have to keep doing it.
Yeah.
Don't
okay.
stop.
Okay. I have another question. You mentioned that you're in the Fort Garry area. I live on the other side of the Jubilee, Fort Rouge. Does this all apply there?
It all applies to Fort Rouge. Your Seniors Resource Coordinator is sitting at the back of the room, Martin Landy. He is based out of this building right here, as well as the Riverview Health Center. But that being said, if anybody calls us from anywhere in the city, I've received calls from Transcona and Charleswood, and I will answer your question or try to get you the answer. But the Seniors Resource Coordinator for your area will know more about the resources that are there. There are some resources that are citywide, but then there's others that are very specific to your area. So I would always answer your question, but then I would refer you to the appropriate Seniors Resource Coordinator, because they may have information that I don't have about your neighborhood.
Well, thank you for the questions and the response. So yes, a follow-up with the Seniors Resource Finder. We do have, I see a couple more questions. There's actually one from YouTube, and then we'll go to the in-person. So question from YouTube for Family Doctor Finder. Would your service help people with mental health illnesses at their home, such as taking medication, assisting with bill payments, attending counseling appointments, and transport?
Short, no, that's not the function of the program. Our function is to match people with a primary care provider. We try as best as possible in your community, but we would look at what your needs are. And if you required additional supports, we have our private practice practitioners, we also have community health centers, and we have WRHA direct op sites, or directly operated sites, that called access centers. So we would look at what your needs are and then try to make a referral based on which organization or which practitioner is going to be best suited to meet your needs. And then they have wraparound supports, often like community health agencies like Clinic and Mount Carmel and those sorts of organizations. And then again, with the access centers, they have often supplementary programs and services that can help with some of those things as well. So we try to make that assessment and make the appropriate referral so you can get access to that through your provider.
Okay, and we do have another question in the room.
Hi, I have windrow issues as well, but my solution is move. And that leads me to my next question. For the housing people, there was an article in the Free Press this Saturday about new rental suites built with federal funding, and 3 buildings at 347 Oakdale Drive in Charleswood. Do you know anything about that other than what was in the Free Press?
I think that, oh, sorry, go ahead.
I think you're referring to Charleswood on Oakdale, and that's not my area of the city as well. So I would refer you to the Seniors Resource Coordinator out there. They may have more information on it.
Yeah, thanks for that response. We do actually have a second session of this happening on November 28th at Bruce Oak Recovery Center Auditorium. And we will have ability to speak to some resources in the St. James' Assiniboine South area, which includes Charleswood. So just for your information, that's the follow-up session. And yes, please connect with the resource finder in your area. There is another question from YouTube. How do I get an assisted living facility list as well as nursing home list? Through 211? Yes, so you can contact 211. If you're connected to the home care program, you can also speak to your case coordinator about getting information about assisted living and long-term care facilities too. There's a question over here in the room. Just right here.
Just while the microphone is going that way, I know we had a question about this this senior guide. So if folks have seen printed senior guides that are out there, that was a partnership that 211 took on, and so my easiest question or answer to that is the second that we print that guide, it's out of date. So things change, and so the best information, if you head to the 211 website, and I acknowledge not everybody has that access, so you can call 211 as well, and we update that guide, so we'll have the most up-to-date information. Unfortunately, as soon as you print something, something changes and it's out of date, so just head to the website or give us a call at 211.
Thank you. Go ahead. Yes.
My question is about personal care homes. My mother has just been paneled to go into a personal care home in Winnipeg. She's from outside of the WRHA. And I want to know if there is someone who, in part of this group, she's on a waiting list for Deer Lodge, and I know that waiting list is very long for their memory care program. Is there someone who can provide advice on other memory care options, kind of before I have to go to visit all of the possible options? Is there someone who's kind of familiar with memory care, personal care homes?
Have you connected maybe with the Alzheimer's Society? You have.
You're looking for detailed information that they weren't able to give you. And you're specifically asking about memory care units in long-term care facilities? Are you connected to home care? Do you have a case coordinator? You. I see. Okay.
I would think that your coordinator would be able to identify the facilities that have expertise in memory care, because there are a few within the city, so they would have Deer Lodge, maybe Riverview, so there should be that connection, and if it's not, I would say call WRHA and maybe inquire a little bit further.
You can also try contacting the central intake line, and that would be the home care central intake line, and they may be able to help you and redirect you as well.
Just to keep in mind that there are assisted living facilities that also have memory care, attached to it. So, not sure where your loved one might be at, if they're personal care home or assisted living, but there are assisted living that also have memory care expertise. Like, I'm not sure. No, that's I think you still are in the assisted living. You still have the independent living factor. So you still, yeah.
And another point, just to clarify, I spoke about the WRHA central intake line. And I'm just going to give a little bit more information about that. So if you or someone you care about might need home care services and often access to long-term care is through the home care program, that there's a central intake line at 204-788-8330. You can find that on the WRHA website as well, but I'll repeat it. It's 204-788-8330. And there's a question here in the room.
Hi. So with regards to the central intake line or somewhere else, what if we have a parent that should not be living alone in their home, but she refuses to leave the home to go to see a doctor, whom she hasn't seen in years. She has mental health issues. She's had a major heart attack, refuses her medication. She's also hard of hearing, but she won't leave the house. Is there any way we can get a health professional to come to the home to assess her? I know I've called most of these people before and waited a day or two for return phone calls, but in the end it seems like no, there isn't such a thing, but I would just think there's a lot of people like this and there should be a way.
Depending upon where you live in the city, obviously this is Fort Rouge and Fort Garry, River Heights, Wolseley. So there are healthy aging resource teams, heart teams. There's 3 of them in the city, but they are catchment specific, but they do support their paired areas. I know there's some of the crew sitting at the back, so they might be a good resource for you to talk to. You guys put up your hands. The heart teams, that is a heart team. So they can work with individuals or service providers to sort of identify what some of the concerns are. EPIC is another program, and the Hearts will be able to tell us whether or not you can call EPIC independently or if that has to be a professional referral. But EPIC is healthcare professionals that will go out and assess somebody's situation and provide some recommendations as well as look at the healthcare component. There's, and I'm not going to get the name right, but there's a city-based social worker, like a City of Winnipeg person that will also can go out and do some of those assessments. So there are a few things in place. I know there's some conversations about.
Say the other one might be GPAT, and again we're awful at acronyms. So we say the geriatric program assessment team, and they also come out into the home and will do an assessment on your loved one.
Okay, thank you for that information. Any other questions? I believe we have one over on this side of the room.
Further to the getting your information from another doctor to your current doctor, is there any move to modernize the medical profession so that when I go to one doctor or I go to a specialist, it's all recorded at my record? Because recently I just got a letter from my doctor who I haven't been to for several years. I am lucky I have another doctor. She wants me to request that information from my doctor. They have to sign a form and send it to her, and I have to pay 50 cents a page for my medical records. So is there any way to make all the medical professions have one central location to put all our files in?
It's a great question and a understandable frustration for sure. I know that there has been some sort of push and coordination to try and get some of the more consistent medical record systems. The way that things work in the province is that each of the regional health authorities may have a system that functions for them based on the needs of the authority. And then private practice doctors are not, they're independent practitioners, they're independent business contractors essentially. So it's a cost that they would have to be willing to incur as a practice to be able to get into having like a broader, consistent medical records system. I do know that there is some push to work towards that provincially, but that wouldn't necessarily include the fee-for-service or the private practice doctors. What you can, though, request is, and hopefully most doctors' offices should honor this, is that for no fee, you should be able to get your medical records transferred onto like a jump drive or a portable drive, and then that way you're not paying for the paper, but you can ask about that as an option. Most places will honor that, but it is up to the individual clinics as to whether or not they're willing to do that.
Okay, thank you for that question. We have 5 minutes remaining, and then we will wrap up this session. Any last questions or comments? Seeing that no further questions are coming forward, we do just want to thank you all online and in person being here today. We hope that the information you received today helped to increase your awareness of health and social services, your system navigators, and how to have the quick access to the services you need to think ahead and plan for your health and well-being. Just a reminder, Eric kits, I see a few are still available in the back. And we hope you found this helpful information session. Thank you all for coming, and thanks to our panelists.